Assalamu alaikum. Thank you very much for the kind introduction. Great pleasure to be with all of you. A colleague of mine was meant to be doing this presentation, but about 2-3 weeks ago, he traveled back to UK, and the resident couldn't really be with us. So I started looking into the topic, and obviously it's a topic that I have selected for the conference, but I wasn't really sure of whether we will be able to find enough information or not. So we know that hypertension is a major risk factor. In fact, it is the most common disease in chronic disease. This is data from Dubai, a household survey that we published not long ago. A third of the population have high blood pressure. Another third are not too far from this. So it's a very common problem. And when you look into the data of people with diabetes, then you'll find that the prevalence in people with hypertension is 3 times. So these two together is really kind of a very bad companions to be together for the same place. So I want to think on this process of hypertension and fasting in a systematic approach. So I want to think first, what is the effect of fasting on blood pressure? And specifically in people perhaps with chronic conditions. So this is some data that's been published, and we included it in one of our studies that looked into pre-Ramadan systolic or diastolic and then after Ramadan. And as you can see, there is very nice reduction in middle-aged hypertensive subjects. So if you have high blood pressure and you fast, the blood pressure might improve significantly. And here is another bigger study on people with hypertension as well. And as you can see, I've dissected the data into green and gray. So green are the studies that shows a difference, whether in systolic or diastolic or both. And gray is the study that did not show a significant change. So perhaps the evidence for improvement in blood pressure in people with hypertension in some studies is there, in other studies it is not there. Now it's interesting also to look into this is data just 2 to 3 weeks after Ramadan, not long time after Ramadan, and it's not during Ramadan. Here is another study on patients with CKD. We had a lovely session on chronic kidney disease with nephropathy yesterday, and it does look like patients with nephropathy, when they are fasting, their blood pressure improve. Actually, I have to be obviously cautious. This is one study from Saudi Arabia. The numbers are not high, so obviously we cannot generalize. We looked into many studies in people with type 2 diabetes, and here is the data of the Darmina type 2 diabetes study that we have conducted, and over the 1,700 persons from across Middle East and North Africa. And as you can see, there is marginal improvement in systolic and blood pressure, diastolic blood pressure parameters. Systolic was significant, diastolic was not. And this is again data from before and after Ramadan. In our hospital, we conducted a study. We called it the optimum care for people with diabetes. There were people with type 1, type 2, type on insulin, a subgroup of nephropathy patients, a subgroup of cardiac patients. And when we look into their blood pressure, lipids, and weight, and I will focus here on blood pressure, there is hardly any major difference, even though they had education and had good monitoring and dose adjustments. So minor changes in the blood pressure that is not really significant here or there. We conducted an interesting study, which we think is one of the rare studies that was conducted in Ramadan in people with diabetes, because in this particular study, we looked into people during the last 10 days of Ramadan. So we wanted to know what happens to the blood pressure of people with diabetes at the end of Ramadan, maybe when the effect of fasting has its toll. And then we compare this information with before Ramadan and after Ramadan, 3 months after Ramadan, to see whether the changes are persistent or whether they disappear. And I'm highlighting here the data of systolic blood pressure and diastolic blood pressure. So as you can see, in systolic blood pressure, there is a reduction during Ramadan by 2 millimeters mercury, diastolic by only 1, and then after Ramadan, these effects are gone. So what we concluded from this study is obviously other parameters. I will not go into address them, but I'm just showing you what happens in this particular study and this data. During Ramadan, systolic blood pressure and diastolic blood pressure marginally improves. So this is so far the information we have in hypertensive people and in people with diabetes during Ramadan and pre and post Ramadan. Not massive amount of data of during, but many data before and after. But let's ask ourselves, the person with hypertension and type 2 diabetes, who is this person? And as you can see, if a person has hypertension, they tend to be 7 years older than a person who does not. Their duration of diabetes will be longer by roughly 3 years. Their HbA1c is not terribly different, and their BMI is not terribly different. Blue is not significant, white is significant. Of course, their systolic blood pressure would be higher. Their LDL will be better because it looks like the physicians are kind of addressing the lipids-lowering agents for people with hypertension and diabetes. Because of the duration and because of the age, more people would be on insulin. There was no difference in sulfonylurea. No statistically significant, just more people. So it's important to remember that in our data with hypertension, 50% are on insulin and 42% are on sulfonylurea. Every single person with hypertension have more rates of complications that's statistically significant in comparison with the person who does not have hypertension and diabetes. Neuropathy, retinopathy, microalbuminuria, macrovascular disease, diabetic foot problems, and some, of course, some of the problems are quadruple or triple, such as, for example, the nephropathy rates. It's over 3 times, and the macrovascular data are also over 3 times. The retinopathy data is over 4 times different between a person with hypertension or not. Retinopathy data are almost double. So the question is, as we are a Ramadan conference, does hypertension, does high blood pressure makes fasting outcome different? And what I did, I looked into the data of people with hypertension versus the data of people without hypertension, and then I've changed my mind that I decided to look into blood pressure, kind of good control and bad control, and ignored the figures in the middle. So I looked into systolic blood pressure below 130 and above 160, and diastolic below 80 and above 100. And first question that we look into, fasting rates. So people who have high blood pressure, whether systolic or diastolic, are fasting less frequent than the people who have good blood pressure. The significant difference in numbers, not statistically significant though. How many of them are able to complete the month fasting? It does look like maybe it did not affect the decision to fast, but when it comes to the ability to complete the month fasting, there is a significant difference. 53% versus 70% were able to fast the full month according to systolic, and 68 versus 57 for diastolic. The actual mean duration of fasting was about 1.2 days or 1.5 days lower in people with poorly controlled blood pressure versus people with good control of blood pressure. The duration of breaking the fast, of course, consequently would be higher in both 2.4 versus 2.1 and 1.8 versus 1. Now, when you look into the hypoglycemia, so did people with high blood pressure versus low blood pressure have more hypoglycemic episodes? And obviously the question mark is this the effect of the blood pressure, or is this the effect of the higher incidence of insulin treatment and sulfonylurea treatment? But nevertheless, the 14% versus 19%, and for diastolic, 16% nearly versus 20%. Breaking the fast because of the hypo, this is just asking people. So marker for the seriousness of the hypoglycemia is I take the decision to break my fast. And here is 70% versus 56%, and for diastolic, 70% versus 60%. So 70% of people with high blood pressure, when they get a hypo, they feel it's serious enough and they stop the fast versus lower rates. Do they go to hospital? Admissions to hospital are very low. Don't forget that the people with poorly controlled blood pressure among our cohort are low when regarding to fasting and hypoglycemia. So I don't think this is simply, we do not have enough number of events to be able to calculate. Even in the large group, it was 4 or 5. So that's one aspect. What about hyperglycemia? The HbA1c of these people were not great. In general, the HbA1c of many people with type 2 diabetes is not good enough, and that is apparent. So higher number of people with high blood pressure, whether systolic or diastolic, are ending up with significant hyperglycemia. Significant as a number, but not statistically significant. It was for systolic, but not for diastolic. And also for both, it was significant from the fact that the symptoms were bad enough to break the fast. And again, the incidents are pretty low, so we cannot really judge very much on admissions. We can simply say admissions in people with hypertension because of hypo or hyper are pretty rare occurrence. The problem we are facing in Ramadan is very much related to what we do. Ramadan is a religious month. We fast, but then we feast. Rather than applying the sunnah of the third for your stomach, for your food, a third for your drink, and a third to breathe, according to the hadith of the Prophet Muhammad sallallahu alaihi wasallam. In Ramadan, actually, the queues in many countries, I come from Egypt, and the queues for having pickles, mkhallin, are large. Every shop is showing bigger display of pickles, and people are getting it in droves. Maybe after the fast, people want something salty. I don't really know. Of course, during the eating hours, many people are sitting after they did their taraweeh, watching telly and having the salted pickles and other things. So for a person with hypertension, maybe education really is key here to try to advise people on what type of snacks and what type of food they would have to try to reduce the sodium intake. So in my conclusion, blood pressure marginally improves during fasting. However, the effects are short-lived to a few weeks post-Ramadan. In people with diabetes and hypertension, many of them are older, with longer duration of diabetes, have higher rates of insulin and higher rates of complications. Fasting outcomes in people with normal blood pressure as compared to people with high blood pressure seems to be somewhat worse, whether for the decision of fasting or having to break the fast because of the hypo or the hyperglycemia. Of course, we need more data to establish whether this is an independent risk factor or simply the effect of the insulin, the sulfonylurea, and the comorbidities that this group of people have. And finally, of course, we need good education specifically for salt intake, and the type of food for a person with hypertension is not just about the hunger, but also about the choice of food for people with diabetes, who many of them have hypertension as well. Thank you, and I look forward to the Q&A session at the end.